So, welcome to another episode of Let's Create a Healing Temple of the Cosmic Powerhouse. Today, we are speaking about artificial intelligence, but not artificial intelligence like you might use it. Very often, we use it now for content creation. And I think the discussion about AI is really heating up. So, we have that topic every day. But today, we speak about healthcare and the usage in healthcare and actually how to empower medical data sharing, but also protecting the patient and the privacy. And more specifically, about the de-identification of multimodal medical data. And I want to welcome for that our studio guest, which is Julia Komissarchik. Hello, Julia. And we could say she's an absolute expert in that area with 20 years in AI and a degree in mathematics and computer science. But before we go deeper into the conversation and hear about Julia's journey, I want to open sacred space. So if you want to join me, it's just to fold your hands in front of the chest and have a deep inhale. And bring your hands up to the sky, up over your head and aside, and create a bubble of energy. So it's your personal energy field. And I bring my energy field and my high vibrational energy about our space, so I can include also our audience to be in a sacred space, which is of high vibrational energy. And that we ground ourselves and pay full attention to what Julia has to tell us today about AI and the usage in the healthcare area. I want to invite you to do 3 deep breaths, to breathe in through the nose, breathe out through the mouth, and just to grow roots into the earth. So a deep grounding. So if you want to join me, we do a deep inhale and out. And inhale through the nose and out. And breathe in and breathe out. And grow roots into the earth. All out. Okay. So, and now I would like to invite Julia to tell us about her personal journey. So, Julia, why did you have put the focus on mathematics and computer science? So what was actually so interesting for you to study in that field? And why did you connect that to the healthcare environment? Was there some specific moment or experience where you were driven to also have more focus on the healthcare area?
Absolutely. So actually, I've done mathematics all my life. I was very happy as a kid to prepare and win math competitions. So I really enjoy mathematics, and I think it's one of the most exciting areas to study because it's not about necessarily formulas or any particular rules that have to be memorized. It's about the way of thinking. It's about logic. It's about taking any particular problem or piece of information and then finding patterns in it, finding logic in it, if there is any. So I always enjoyed that. And I really encourage everybody else to at least get a taste of mathematics. Because a lot of times it's rejected as boring. It's not.
Yeah, I was the same, I have to say. And I found back to that actually with spirituality, because I was interested very much in sacred geometry. And in sacred geometry is all about specific angles and the patterns, like you say. And then it got very interesting for me to see what kind of patterns and themes we find in nature, in the divine creation. And that is where I got really very intrigued by that. And now I'm even drawing sacred geometry and I love it.
Yeah. And it's actually was a really good book called, I think everybody's seen the movie Contact, but there's also a book that was written by Carl Sagan. And there's an interesting thing at the end of the book. So not to give away the book, but they were discussing number pi. And they were discussing that they found a pattern in the number pi. And then at the end, what they find out that the higher beings that are more experienced also don't know who created the pi, which is basically defines the circle. So I think the audience will get a kick out of that movie. It's called Contact. Not movie. There was a movie, but I mean the book itself.
I know the movie. I love it very much. So as we see, I'm very connected to the cosmos. So I'm really feel like an awakened star seed, and I'm able to communicate. So don't want to go deeper in that. It's a specific field. But yeah, I love that you're mentioning the movie, and I did not know that the book could be so interesting.
Yeah, as one filmmaker told me, don't judge the book by its movie.
Okay, I understand.
It was
Thank
a bit
you so much.
tongue in cheek. So that's how I started with mathematics. Why healthcare? Because I'm not a doctor. My co-founder is not a doctor, but this is our opportunity to help using our expertise, which is AI. That's why we're so focused on AI in healthcare.
Okay. And is there any, because our show is focusing also to support some kind of healing movement. So it's wanting to create an environment which is more spiritually tuned, especially in healthcare, where we tend to be more looking at the numbers, at the finances, at the budgets, and patients as a case number, which is for your work, I guess, very important to have that.
Yeah, that's true.
So in your life, besides mathematics, so did you also tap into that areas, into meditation, or are you very connected to nature as well? So how do you feel spirituality in your life personally?
Oh, I see. Well, meditation always helps. For example, that deep breathing, when somebody's stressed out, it does work. You know, there are different theories behind why it works, but actually at the end of the day, it does. And that's what matters. So that's actually an interesting thing which we discovered, you know, everybody discovered, I think, in healthcare and in life in general. There are different explanations behind certain things, but they do work. And that one of them is deep breathing. It does help, at least for me. You know, I'm not a doctor. I can't give anybody advice.
I learned from my teacher, Dr. Alberto Violdo, so about the number, so 4 breathing, that we have that rhythm. So yeah, everything in the universe actually in divine creation has some patterns, right? So it's really, especially when you're talking about sound frequencies, you all see that kind of mathematics behind, and that's really amazing when you're tapping more into it.
But also, if we're speaking of frequencies, right, it's also music, and we'll enjoy music. So that's, you know, if anybody has ever heard organ music, right, for example.
Organ?
Yeah.
So you might love Bach, maybe?
Yes, I do, of course. But not only that, right? Any kind of music, if it's done well, if it's inspired, and that's something that helps immensely.
Yeah, but yeah, I mentioned Bach because I felt when I also was working in sales and had a very busy mind, and Bach was actually helping me a lot. So that clear structure, that's I'm connecting to mathematics, because we know his compositions are very, very well structured, and it has some complexity, but I love the complexity. And when I listen to music from Bach, I feel totally wellness for my brain. And that I found always interesting. So when I was driving longer distances, I was listening to Bach, maybe to the office, just to have some relaxation for my brain. It worked out so well. So that's why I was connecting that and was interested if you have felt the same effect.
From what? In my particular case.
Okay, yes.
Same principle. Yes, absolutely.
Yes, same time. So in the Baroque time, it has some style where we see that some sound files are especially meant for not only wellness but also focus. So music helps a lot. Yeah,
absolutely. Yes, it does, for sure.
Understand. So it is mathematics, nature connection, meditation, and music. And when we look at the greater vision now, before we go more into specific things, so when you look at the healthcare system right now and the healthcare or healing environment, we have a bigger vision, so which is also created based on your experiences and what you studied and you're focusing on.
Well, the greater vision, unfortunately, there's some scary statistics, right? I'm a mathematician, so I'm looking at the numbers. And that is the population is aging, the population is growing, the number of doctors is not. So we're getting bigger and bigger gap between help available and help needed. So in a sense, where there is no other way for us to do but to have AI in healthcare, That's the only way we can actually compensate for lack of doctors.
Mm-hmm.
So for me, at least from where I'm standing, it's a no-brainer that we need to have AI in healthcare. However, at the same time, we have to be very mindful what we do. It's not just, this big black box, AI in healthcare, and we forget about thinking about it. It's something that we, as patients, as citizens, need to think through very carefully. Because AI, we don't necessarily want AI to make major decisions, right?
Mm-hmm.
It should be an assistant rather than a decision maker.
Mm-hmm.
Also, it's the question of something that we are very passionate about is AI is as good as the data it's trained on. Because if you're looking at AI, there are three components. One of them is the model. Another is the servers or access to those servers to train those models and run those models. And the third is data. The models, an example will be the LLMs and other newly developed models that are highly promising that everybody's right now thinking of when they're thinking about AI. They're not the only ones existing, but right now they're getting to be popular. In terms of servers, that's where the conversation is. How can we get servers? Where will we get energy for the servers, etc.? It's sort of outside of the scope of this discussion. And then the third is the data. And here's the problem. For example, if we look at the statistics at what the AI and healthcare models that are currently available on the market or approved by FDA, where they were trained. So for example, in the US, they're trained on a handful of large hospitals, which is actually very dangerous because if the models are not trained on the right data, they become biased and they're also not applicable to other populations. And if we're just talking about large urban centers, then suburban centers, inner city, tribal clinics, small hospitals, patients in all these locations are no longer covered. And as a result, those models will not work. And that's very dangerous. So for us, that's the biggest concern that we have. And that's why we're focused on that. How do we make sure that the patient's privacy is protected at the same time that we as patients and hospitals can share data with researchers so the models that are trained and then will be forced on us one way or another are actually working on us.
And how much is then the government or the bodies aware of this concern, of this issue you're mentioning here?
It's getting better. There are a lot of conversations in different countries. We come from different countries, you and I, right? Even different continents. Different entities are looking into this. For example, in the US, there are some state-driven initiatives as well as the federal initiatives that people are looking into. Some countries actually created those data sets to provide them for their own AI and healthcare companies, exactly for that reason, to make sure that the models that are being developed are actually applicable to the population. One of the notable examples of this is Korea in their data set. And that's why we're actually seeing a lot of Korean AI and healthcare companies who are much better than others because they were trained on large volume of the diverse data and just representative data for any particular use case.
Yeah.
So it's not just government, right? There's several players there. There is the government, there is the private sector, and there's the individuals. Because the other side of this coin is we as individuals don't want to just share data as is. Because once it's shared, it's sort of, the horse bolted you. There's no way to get it back. And actually, a lot of information in those records are highly sensitive. So let me give you another piece of research data. Once again, mathematician, data point. There was research done a couple of years ago, I think it was like 2017, so quite a few years ago, but they were looking at the dark web and the prices of various pieces of information on the dark web. Social security number, that's the number that in the States, everybody has. Costs, if somebody wants to buy mine, it will cost them like, I don't know, 20, 30 cents, right? Maybe 50 at most. If we're talking about medical record, then it will be $200 to $300. And there's a reason for it. Social security, that's just financial information. Things go up, go down, so many different things. Healthcare stays. If somebody had a childhood disease, they'll have the childhood disease. Nothing will change it, right? Same thing for if they had COVID or not. Anything and everything is very sensitive and very permanent. So when we as patients thinking about how our data is being shared and used, we have to be very careful to demand that it's de-identified. The good news, in most cases, if it's de-identified, then it's quote unquote safer to share and it's actually can be used for research. It's one of those things where we're between two problems. One of them, if we want to like not share data at all, then unfortunately the models will not be actually applicable to us. But if we want to share data, we don't want to share everything. We want to be very careful and judicious in what we do. And de-identification is one of the things that makes it easier and safer to share.
Yeah. Maybe you can tell us and our audience what de-identification really means so that we can
Yes,
learn.
this word. So de-identification means, so for example, if let's say you have an X-ray. In most cases for X-rays, what you're looking at is an image itself, and it will have your name and your date of birth on it. This information has to be removed because of GDPR, HIPAA, depending on which country you're at, or several other laws which are similar. So that would be de-identification. So taking the image and removing the name and the date of birth and date of study from the image itself. That would be an example of de-identification. So also quite often, for example, for X-rays, they're in so-called DICOM format, which actually also has meta tags. Meta tags, as you would think, it's additional information about the patient, additional information about location where it was done, and other things. So this information also has to be de-identified. So that's the identification, sort of the first stage. But it gets trickier because sometimes X-ray can show a pacer, and that pacer might have an ID right in it. That means that even if the name is removed, the patient is still identified. It gets even worse because if you're talking about something like or brain MRI or CT scan, what it is, it's slices of a head, right, shown as an image so that you can see inside the head. But the problem is those slices, they can be recreated. And then even if the name is removed, you actually have a face of the patient. So that face has to be modified. But you don't want to modify it too much because then the result will not be useful for research. So it's another one where it has to be a balance between two things. And we're just getting started, right? There's other things. Very long answer to your question. What is de-identification? A lot of things, and it depends on which modality, meaning, is it X-ray? Is it CT scan? Is it photo? Like for dermatology, you go to a dermatologist or you send an email to a dermatologist saying, I don't like this spot. But what if once you were photographing your, hand, you actually accidentally also shot your tattoo, which will identify you? It's fine if you're talking to your doctor because your doctor knows you. But what if the doctor then or the hospital will need to use this data for research? Then that tattoo is actually now protected health information that should be removed before this data is used for research. Another long answer to your question.
I see the dollars behind for all the work done on the data to, de-identify.
Yeah, that's where AI comes in. Actually, it's helpful, right? Because in its best shape, best form, it actually mimics what the humans do. Because if I give you a photograph with a tattoo, you'll know what needs to be removed, which is tattoo, and you will sort of shade it out, right? Same principle.
Okay. So, and from a practical side, I can also imagine, so when you have to share data, you also have the barriers technically, and security systems. So I remember from my time in healthcare and talking to hospitals, that was always also a topic. So how can the systems work together and how can you transfer data and also go through the barriers, which are there, of course, for security. So how do you handle that?
Yeah, so there are actually two problems, right? One of them, you just described security. So privacy and security go hand in hand, but they solve different issues. Security, so if let's say I want to share data with you, security will be to make sure that nobody can penetrate our conversation or our responding systems. Privacy is about the fact that even if I want to share data with you, in most cases, I shouldn't share who it belonged to, which is the PHI. So privacy is about how do I cleanse the data so that it will be safe to share with you, because you won't be able to trace it back to the patient. You can use this for research, and that's fine. Security is about how do I make sure that nobody who shouldn't even have access to the data gets access to the data, de-identified or otherwise. It's just that one of the things which is once the data is de-identified, it stops being so interesting. Because if it's just an X-ray without any trace back to the patient, its value, well, reportedly on the black market will go to zero because except for researchers, nobody else needs this. You see what I mean? So that's why they're sort of going back hand in hand, but at the same time, they're two separate issues with very different solutions. So you're absolutely right. Security is another thing that needs to be discussed. And multiple aspects there.
Yeah, and what I experienced is that hospitals, it completely changed over the last 10 years, I would say 10, 15 years. So we have much more experts in the hospital also who are caring about IT and security and systems and data. So of course there was a need because more technique, more support with IT and technical solutions also claims then more experts who are dealing with that. Yeah, and also I can guess it's quite some work to get the healthcare staff trained also to work with those data, right?
Yeah.
So who's actually involved in all of that kind of processes when you do a research project or some kind of work in the scientific area?
So you mean the hospitals? For the hospitals, they're actually
process. So you would be from the company with the software, of course, but to whom do you speak then into the healthcare area?
ideally nobody. Facetious answer, but because, and that's why we are adamant that this should be a software, not a service. And my team should not have access to customers' data.
Mm-hmm.
It should be a piece of software which is run by customer on customer site, so that the before and after results are visible only to the customer and
Mm-hmm.
only to authorized users within the customer system. So that's why I say ideally no communication, and that's how it should be.
Mm-hmm.
You know, one doesn't want to have a service or an so-called API, which is technical, same idea, right? Where you take the very sensitive data and then you send it somewhere else to be processed.
Mm-hmm.
And then they send you back cleansed data. That's dangerous because that means that somebody else has access to all very sensitive data. And
does that happen very often? So is there providers who are having that kind of practice? So how is the market in that area?
Well, Google has an API, AWS has an API. A lot of companies have it. And usually how it's handled, it's with so-called BA, Business Associate Agreement. The challenge with BA, especially if it's like a network of multiple hospitals, it's as strong as its weakest link. Because if, let's say, there's like 5 hospitals that are sharing data between them, and they all have BAs, and then one of the hospital gets penetrated by the bad guys, that means that all the data of all 5 hospitals, if depends on how the things are set up, is being exposed. So that's why we are very keen on promoting, let's cleanse the data so that it's no longer attractive, it doesn't carry as much value, and as well as it ensures that no matter what happens, the exposure of this data won't come back to the patient.
For me, it sounds very interesting, right? So I can imagine that, hospitals, researchers must be very interested in those de-identified data to, actually work with them. So how's the business life working with them?
Well, it's something which is starting to people become more comfortable with it, right? Because this is, sharing data is so dangerous. So, and that's one of the things which actually, it's a good idea that everybody is cautious and thinks of it very carefully, because, as I said, once the data is released, there is no way to get it back. So we work with, as far as our company is concerned, we work with labs, hospitals, pharma, government, anybody. One can think of 2 use cases where what we do is very much needed. One of them is if somebody wants to share data. So before the data is shared, the data is de-identified and then shared by the customer. And the other one is somebody wants to bring some data in-house, let's say pharma, from research, but they don't want to expose their employees to PHI because maybe accidentally one of the data contributors sent the wrong file. Then they're using it then somebody like pharma will use a sanitizer to cleanse the data before it enters the system. The way to think of it, it's almost like what we do, for example. It's a laundry service. It's not a laundry service. It's a washing machine. Okay. You install your washing machine inside your house to make sure that no dirty laundry, aka PHI, leaves the house, or no dirty laundry enters the house. That's it.
Okay, very nice image. Well, when I think on the patient, so when we're talking about the patient level, so as a patient, I of course have to agree, right, to share my data and so on. How is it actually working that a patient really is aware of that kind of topic in itself, right? So I can imagine it's not so easy that a patient can make easily that decision also, or can see what it really means to share the personal data.
And that's a good thing to ask. How is my data being used?
Yeah, and how can a patient really have the foundation to make a decision about that? So because there might be never heard about that, never heard about the risk really, never can grasp what the risk really is. So I would say it's not that easy to, as a patient, to really decide, so is it safe? Is it not safe for me? So do I have to ask more questions, that there will be no data shared? I really don't want to have it somewhere outside, right?
Yeah, and that's where patient advocates come in, conversations with patient advocates. But in general, first of all, depending on the law, sometimes if data is de-identified, then the patient doesn't need to provide a consent.
Oh, okay.
Because it's de-identified. It's not related to him anymore. It's just data residing in the hospital. So it depends on the law. I know I'm not a lawyer, so I'm not going to speak in that direction. But just in my experience, just thinking through it is half the job. Just not being unaware of the fact that whatever data the hospital has, you have to know what are they doing with it. Asking questions. It's not the full solution, but it's a really good first step.
Could it help? I know more the German patient safety organization, so there might be others in other countries. So could that kind of organizations help also in that area to support also the patient itself to have some kind of checklist also when you're in the hospital or when you're in contact with that, or you're having that situation that you know what you have to ask or have to critical think about.
Yeah, exactly. Because once again, it's two edges, right? One of them is we need to think about how our data is shared, but at the same time, we need to make sure that our data is shared, because without it, the models that will be built without us and won't be applicable to us.
Yeah.
Just the reality of life. So once again, a balance between the two extremes.
Okay. Yeah, and I think it's also with a database, it's not that easy, right? Because you have that different kind of countries, continents, but we know, especially in the US, you have so many different people. So it's you need to be aware to have the absolute mixture of and representing really the society in that area, right?
Yeah. There was an old joke, well, true or not, about one of the first AI systems trying to train itself to distinguish between huskies and wolves. And on the images it was provided with, it was 100% correct. And then when the researchers tried to use it on just random images of huskies and wolves, the system failed miserably. And the reason for it was the difference between the photographs of wolves, which were shot primarily against snow, and huskies, which were shot primarily on the couch. The system learned the difference between a snow and a couch, not between huskies and wolves. And the reason for it was because all the images of wolves was in the snow, and all the images of huskies was with, couch or some comfortable sitting. Well, whether this story is true, it's actually very indicative of what sometimes models do, right? They can hone on wrong thing.
Yeah. They think also sometimes very simply. Right?
Well, it doesn't know any better, right? So yes, the difference is whether it's outside or inside.
Very nice, thank you. Yeah, so from your perspective and all your experience now, long experience, what would you say? So how should the journey go to? So what are maybe 3 important things also healthcare providers need to think about the de-identification of data and working with patient record data?
I would say 2 things. One of them is make sure that the data you're sharing for research is de-identified. At the same time, make sure you're sharing data for research. The sharing can be done on a sort of exchange where 2 universities, for example, exchanging information between them. It could be so-called data monetization, where the hospital and the patient are compensated for this data being used by AI models. But it's very important to think about how to share this data and how to compensate both patients and providers for it. And that's one of the conversations that some governments and some organizations are starting to have, how to create those data exchanges.
Yeah. So you're speaking about also business, right? So it's, yeah, we know, I think there's nearly no country which is not having some financial constraints in the healthcare areas or in hospitals. So we have that discussion about finance and budgets every day. So you're telling us that it could be also lucrative. So it could be also really a value, seen as a value that you have that data as a healthcare provider, and and using it also like a different kind of business income viewed as a commodity.
Yes, but it has to be de-identified. Patient's privacy must be protected. That's why it's sort of two things, right?
Yeah.
But yes, absolutely. A lot of hospitals are in the red, and they're sitting on a treasure trove of data that actually will be extremely useful and needed by researchers. It's the question of how to break through those silos.
Is it talked about a lot? So because I cannot imagine that I heard so many discussions about that.
It's starting to be a discussion, a regular discussion. For a while, it wasn't even raised as such because most of the research was done on a handful of patients, just by definition. But now with models, especially with LLMs, one has to remember open like ChatGPT that everybody's talking about, or DeepSeek or anybody else, they're trained on publicly available data. This is internet data, right? Anybody can have access to it. And they're running out of that data to avoid bias and non-generalizability, meaning the models are not useful in different things. For AI in healthcare, they have to have access to those very sensitive patient records. And without those records, models will fail. No matter how sophisticated models are, if they don't have access to the data, no matter how many servers the group has, without the data, it's just basically, metal in a model, and that's it, but no results. And that's very critical. That's why I'm saying two things. One of them is patient's privacy, and another one, we need to share data. We don't have any other choice, but we just have to be very careful about it and very thoughtful about it.
Yeah, so I can imagine there's also some part in the discussion where you involve moral philosophy, So also,
yes,
when you're talking about that area, so I'm just thinking about a book I have read and was very interesting about. So to ask better questions and to really having discussions on different kind of topics and questions for society, which we were barely missing, and now we are still running for information and a lot of consumption of data and information. But my experience is not enough asking questions to really get the wisdom out of that.
And actually, one of the things which I'm hoping for is we're going to schedule a webinar with a professor of ethics, and we'll discuss exactly those questions. Because yes, absolutely, there's a lot of things that need to be thought through. One of the initiatives, which is picking up, it's called responsible AI. And that's exactly what it sounds like. How do we make it so that that we discuss the bias, we discuss how to make sure that AI is applicable to everybody. And so as part of that discussion, I'm hoping to have that webinar and talk to the professor of ethics about this.
Okay. So is it a webinar what you are offering from Glendor, or is it?
Oh, no, it's one of the universities. They just invited me.
At the universities.
So once I don't have that information yet, so that's why I'm sort of just alluding to it without giving the facts yet. But once everything is set up, then I'm actually very excited to have this webinar.
Yeah, because maybe in our audience there are some people who would be interested to have maybe the chance to watch the recording, or so hear them more about that, because I feel also that it is really missing in all that discussions, that we bring more that ethical and moral philosophy way of looking at questions and areas, that we bring that in. I'm not sure, like the United Nations are doing that. So from time to time, I see Antonio Guterres talking about AI, and that the UN is also trying to bring, don't say guidelines, but discussing the topic also from different angles and bring more critical view on that. Yeah, what do you expect then for the next 1 or 2 years? How will that evolve? So do you see that there's more discussion now going in that way? Do you see that coming up more?
I think so. Talib Nasib, who created the Black Swan concept, he also has a really interesting book. It's called Anti-Fragile. And the idea there is that the most robust system is the one which has multiple different approaches and multiple different takes on the same issue. And then in that combination, that's where the system becomes more stable.
Mm-hmm.
So that's what I really like, the idea of having multiple conversations. It could, could be political, it could be government-based, it could be just business-based or human-based. So there's so many different discussions we should have, because I think it's still very much an open-ended question. We as a society haven't decided it.
Yeah, I think that is also far away, right? Because it's so much progress. It's really very much speeding up. And like I say, so more to talk about the cosmic energies and so on. So we have a lot of influence that things are speeding up. The change is so much quicker going on, transformation.
Right, and I agree with you. But the important thing is that we talk about it, because otherwise it will be decided without us as a society. And that's the dangerous part.
Okay, so Julia, thank you so much so far. So yeah, telling us a lot about the usage of artificial intelligence and the process of the identification of multimodal medical data. That was very, very interesting. And I guess our audience has a lot of questions still, which they would like to ask you. So how can they reach out to you? Is there on your website the possibility that you have a contact formula, or what is the best way to reach you or to get some more information about that?
Yeah. So yes, of course, you can reach us on our website, which is glendor.com. You can also just email me directly, which is julia@glendor.com, or connect with me on LinkedIn.
So we will also provide the contact details with a podcast session, of course. In the description, you will find then the links that you can reach out to Julia. And yeah, for the closing, is there any call to action you want to bring out? So about your area and about what's going on in healthcare and for the future?
Well, I would say think.
Think before share.
And also just think through AI. What are we using it for? How should we use it? And how can we use it for good? How can we expedite it, while still at the same time making sure that we're thinking through the side effects and consequences?
Okay, thank you. Yeah, I would say that is very good advice. Yeah, so we still can feel very much passion inside of you for that area and for your work. So is there something specific, some special recipe that you get this fire inside of you burning for that special topic? Is there something you're doing?
Well, whenever I talk to the doctors, the ones who actually help patients. For example, there's a very interesting, actually multiple initiatives for the rare disease community. Mm-hmm. And every story afterwards, that's as inspiring as it can get. If we as a company and me as a person can help, that's worth a lot. So that's what keeps me going. It's an exciting space where hopefully we can actually help.
Wonderful. Yeah, I get goosebumps when you're talking about that, because also that was our first podcast session then about rare disease, and with Frank Grossman. And we learned a lot about rare disease and how to also handle that in that area, and what we can do to support that there's more help, and help not only for the patients, also for the families, of course, so for the whole area. Yeah, and last question about legacy. So is there something you have in mind, though you leave behind before you leave the planet? So is there some book writing project or something where you would like to share your wisdom with the society?
I'm not sure about that. But the joke is that everybody has one book in them. So yes, my partner are writing a book that we're about to publish, but that's something for the future conversations. But yes, that'd be helpful. And of course, the subject is data privacy, data sharing, and how can we advance AI while still protecting patients? So help them without impeding their privacy.
Okay.
So
very well. So thank you so much, Julia. It was really a great pleasure talking to you and learning about that topic much more. And so I close my cosmic powerhouse with taking the energy field back. And thank you for the audience for listening and watching us. And I hope you will think more about artificial intelligence, how to use, how to share also your data, and why the big why also behind, and you learned a lot from our conversation today. And yeah, like Julia said, if you have questions from the healthcare sector, reach out to her, and we provide the links and contact details. And I hope you found that so interesting that you will follow up and also listening or watching our next episodes and support our Let's Create a Healing Temple show, because we all are called to create a healing temple together. Thank you. Thank you so much.
Thank you.